Ram Dass has another quote that I love, not to overquote Ram
Mhm.
Dass,
Go ahead.
but um, he was a prolific mindfulness and spiritual teacher. And he had a stroke later in life and lived his last few years of life in a very different physical and mental state than he did for the majority of his life. And he said, I would never wish a stroke or the disease on anyone, but I would wish you the grace that comes from. And this is not toxic positivity because we're allowing that uncomfort to be there and acknowledging it and giving it a seat at the table. And we're also pulling up a chair for the part of our brain that we know we have to feed with supportive thoughts of knowing that this is positive for your experience.
Hi, everyone. Welcome to another episode of Unpacking Possibility. I'm your host, Traci Stein. As always, I'm so happy to be here with you. My guest today is delivering such an important message, useful to so many people. And her name is Melanie Lown. So, Melanie is a mindfulness teacher, an educator, an advocate. And she's going to talk with you today and with me about mindfulness and its utility and helping people to not only live with, but thrive even with having multiple sclerosis. And of course, mindfulness has broad applications well beyond that. But without further ado, Melanie, welcome.
Thank you so much. I'm so excited to be here and to have this important conversation with you today. Sure, there will be lots of wonderful nuggets to unfold.
Yeah, absolutely. And it's so great to have you here. I wanted to begin actually by reading a quote from your website about your journey, because I think that's going to say it far better than anything I'm going to say. And I think it'll be a nice way to kind of segue into what you're here to talk about today. So, you have said,
Mhm.
while journeying through a life changing diagnosis, I found that discomfort can serve as a gateway to equanimity and prosperity through mind, body, and spiritual engagement. Meditation was a path to remember myself in a way I hadn't realized I'd forgotten. Rather than solely serving as a refuge away from my challenges, meditation allowed me to bravely accept my circumstances with kindness and compassion, and to choose to participate in my experiences with openness and curiosity. Talk a little bit about that.
Yes, thank you so much for sharing that from my website. Yeah, so I really came to mindfulness actually almost 10 years ago. Someone gifted me The Power of Now by Eckhart Tolle, which is probably how a lot of people brush up against mindfulness in the beginning. And I remember driving in my car and just thinking about the book and kind of like, musing over the different things that I had read that day. And I had this like epiphany and this felt sense of relief of, oh my goodness, it's like right now, me like doing this very mundane thing, driving my car. That is what it actually means to like be in the present moment. And, as someone who has been very anxious before in life, I think I had for really the first time experienced this quick moment of relief from, discomfort. And of course it went away quickly and I had little touches with that experience, that present moment experience a few other times and, explored mindfulness and meditation a bit, but I didn't really jump in and I wasn't really immersed in this practice until I was diagnosed with MS, which was in 2018. That's kind of what pushed me into the practice a bit deeper. I was sitting in the hospital and someone told me actually they thought I might have a brain tumor and not multiple sclerosis. And I really experienced the present moment in that way. It's like someone pulls the rug out from under you and you're just here and your feet are solidly on the floor and nothing else in the world is going on. And that was a very different present moment experience than I had had, several years prior after my musings of the power of now. But still, it's um, this very like embodied reaction to and response to life and what's going on. The first time it was a very mundane thing, driving the car. And then the second time it was a very marked life moment, of feeling like, oh my goodness, like I have either, a really serious chronic illness, or someone is telling me I may even have a brain tumor. And so in those moments, although it was different, it was just this deep interaction with the present moment. And yeah, my first big experiences and my first big push then into the practice as I started to interact and curiously explore how I was going to manage the day-to-day interactions then with this chronic illness.
Melanie, I'm wondering if it's worth us having you explain just briefly for anybody who isn't clear on what MS is, some of the symptoms that you had or how it was explained to you when you were in the hospital. Clearly, you were very unwell to wind up in the
Yes. Yeah. So, I'm a lifelong dancer, and I actually have, before I got my BA in psychology, which then led to my MA in psychology. I actually had a BFA in dance, and I taught a lot of dance over the years, and I knew my body very well. And I started to feel a little bit of tingling on the right side of my body and thought, this is weird. I just am going to go get a massage and then everything is going to be fine. And so I did go get a massage and everything wasn't fine. And I started to have more tingling and more numbness, now down more the right side of my body into my leg. And then I started to notice I was having trouble running. It was like I kind of forgot how to run, which is a very strange experience. It's like you go to start and then not a lot is happening. And I was interacting and meeting with doctors throughout this. Of course, I first started with my general practitioner, and they also, suggested maybe you should get a massage, maybe you're stressed. Maybe you have tennis elbow. I had someone tell me, and I had to really start advocating for myself that no, I think something is wrong, and something else is really going on here. And eventually, really pushed to see a neurologist. And even the neurologist said, I don't know, I don't think it's anything. I saw them twice. By the second time I'd seen the neurologist, I couldn't lift my heels up off of the ground. So as a dancer, that's releve, when we rise up on our toes. And that's like what you learn in 3-year-olds ballet class. And I couldn't do this, as an individual with a degree in dance. I couldn't lift my heels up off the ground. And I knew that something was not right and really pushed. I thought I had MS. I had done research online, which I don't suggest, really going down the Dr. Google rabbit hole, but I had looked things up, symptoms online, and I thought, this seems to line up with MS. And I advocated really strongly with the neurologist that I have an MRI. And then, they called me within an hour of my MRI and said, you have, active lesions in your brain and you should go to the hospital, right now because you need to get IV steroids. And So MS is an autoimmune condition, neurological. It attacks the myelin sheath, which is like the protective coating around our nerve endings in our brain and our spinal cord. So you can have neurological symptoms, or you can have some mobility symptoms. Sometimes it just feels it's sensorial, and just tingling and numbness, and then sometimes it can be cognitive brain fog, or even, difficulty in movement.
Yeah, and, you're a young woman
Mhm.
and you are going I'm laying this out, what you just said, because I think this is not an uncommon scenario, unfortunately. You go from provider to provider to
Yes.
provider to
Right.
provider, and no one's really taking you seriously. Is that a fair assessment? Or they're assuming it has to be something else because you look like a healthy person, in quotes,
Yes.
um, and no one wants to think that this is a chronic illness.
Yeah, it's an interesting thing I found in interacting with healthcare, actually. You are kind of written off at the beginning of, oh, this couldn't be anything, this is stress. And I've really come to have a lot of empathy and compassion for healthcare providers, where I used to just be very frustrated with the experience, which I think is, of course, an understandable reaction or response to have. But it's almost like this pendulum swing of nothing is wrong, nothing is wrong. And then when there is that little bit of evidence that something is wrong, the pendulum swings, and the experience for the patient can be really jarring, because you've gone along, and for me it was advocating for myself, really pushing, I really think we need to look at this further. And then finally somebody was like, okay, let's look at this a little further. And when it did end up being something that needed attention, then the pendulum swung, and now I'm feeling like the world is ending, and almost very protective over myself. And it can be a lonely experience, and like you don't really know who's on your team. You grow up, especially if you grow up in this Western world, thinking, doctors are here to protect me and provide for me, and they are, and they can be. And I've worked with a lot of incredible doctors,
Agreed, agreed.
and at the same time, it's um, they have a lot to do in a short amount of time. And I think that sometimes the attention and the mindful care for each individual isn't always possible with the way that the system is set up. And that was really my experience.
Also very much agree, and what you're saying is actually, I don't think uncommon at all, unfortunately. Um, and we could talk we could have a whole other conversation about the system and how the system really isn't set
Yeah.
up for
Yeah.
doctors to be able to spend that time, you know, but for you, I imagine you also at the time were juggling a career.
Right. Yes, I did have a job, married, was trying to live this like vibrant early 30s life. And yeah, that all did just kind of stop. I was actually supposed to go out of town for a work retreat that day, and called my bosses and let them know we had a personal relationship. And so I kind of told them what I was going through, and I zoomed into the retreat from the hospital, I think for maybe a feeling of normalcy, and just like a touch point of community too at that time. But yeah, I was like really trying to live this vibrant early 30s life. And I considered, even from the beginning, and I think everyone's unique experience is so important and should be lived as honestly as possible. And for me, from the very beginning, MS was, it was an opportunity to look at life differently, and I'm grateful for it. And I did experience that gratitude from the very beginning. I don't think everyone does, and that is completely fine and great. And I do think you should process it, if anyone's listening going through something similar like this, as honestly as possible. That was my true experience, though. I did just have that felt sense of, this is an opportunity to jump into a really fulfilling part of my life, and to live things a little bit more honestly and mindfully. And I think that is why I really was pushed into the practice at that time. Yeah, gratefully so.
Yeah, I do think that's really unique, and it's to your credit that you were able to take what you had learned previously about being in the moment, whatever it is, right? Not grasping at it, not pushing it away. So much easier said than done. Um, but talk a little bit about how that shaped your journey.
Yes. Yeah, definitely. Um, I think it did immediately kind of allow me to reassess where I was. I loved my job. I had a lot of fun at my job, but I knew that it wasn't a life calling. And I think when you have those moments that really kind of wake you up to where you do feel the feet planted solidly on the floor, like the rug pulled out from under you, as I had said before, you start to think, how can I live in the most fulfilled way? And I had started a degree in psychology, almost 10 years before, and I never finished it. And I just felt this pulling to go back and do that. And so I went back to UT Austin and finished my bachelor's in psych, and got involved in some research there on imagination and fantastical thinking, especially in children. And one of our studies was looking at how children conceptualize God. And I was just very interested in this topic, and started to really get interested in the intersection of psychology and spirituality. And that pointed me to a degree at Columbia University. And I got my master's in psychology with a concentration in spirituality, mind, and body, and got to be a part of some research there as well. And I really refined, exactly what I had been kind of thinking and experiencing through this health circumstance and just life in general. How much mindfulness was really, it was this foundation in my world that I didn't realize the how crucial it was to keeping my feet so solidly on the floor through all of that. And I think, through all of the research at Columbia, my own experience there, I saw that very clearly. And so I really start to become really interested in teaching mindfulness and in sharing this and in what I had learned. Um, and so now, I'm just so honored to teach and really to practice alongside, anyone that I have the opportunity to interact with in a, teaching setting. Although, like I said, it's truly just practicing alongside. And one of my favorite Ram Dass quotes is, "We're all just walking each other home." And I really do believe that, especially in this role as a mindfulness teacher and educator. And yeah, it's just been incredible.
And you've done additional training along the way. I don't know if you want to talk a little bit about
Yeah.
that.
Yeah. So I did a 200-hour mindfulness teacher training, which was amazing to really dive into a little bit more of, the traditions of practice and all of the techniques that can be so useful. I think, we can experience it and go through it on our own. And then as we start to guide others through the practice, looking at the techniques with a little bit more of a refined lens can be so useful in ensuring that, their experience is also supported in a very, quality rooted way. So that was amazing to be able to do that. And then, yeah, just being able to do my own, it longer sits and practices, whether it's on retreat or, with teachers, um, online or in person who I just really admire, of course, deepens my own work. You can't really teach this work unless you're continually deepening your own practice. It just doesn't work that way. You can't teach this if you don't really embody it and believe in it.
I love that you're saying that because it's so true. Um, Embedded in what you just said a moment ago, being able, you noticing that you were able to do longer seated meditation,
Mm.
that's getting at something I really would like us to talk about next is, well, first of all, maybe defining mindfulness for
Mhm.
people who maybe know the term, but have not yet practiced it themselves formally. And then talking about, well, what does that look like in the day to day management of MS or really any other thing that is challenging to sit with?
Yeah, that's such a great question and such an important piece of the conversation. Mindfulness today is really in vogue. Like we see it all the time. You can scroll through Instagram and see it, or even you can turn on Netflix and watch, a documentary on mindfulness, which is incredible. I think it's amazing that it is so accessible and people have more of an opportunity to brush up against it, just as I did, in 2016 when someone gifted me The Power of Now. I actually really love the accessibility. And at the same time, I think that ironically, we use mindfulness a bit mindlessly sometimes because it is so saturated. We're just overusing it, perhaps. So peeling the layers back to understand what mindfulness really does mean is really important, and I think skillful in everyone's own journey with the practice. For me, in that first experience of it, it was that felt sense of relief that I could really feel in my body, in my chest and in my stomach. Even though it was fleeting, it was that awareness of something happening, in my mind and in my body with this interaction with the present moment and my thoughts. Um, John Kabat-Zinn, he is the founder of mindfulness-based stress reduction. And mindfulness meditation came over to the West in like the 70s with 3 to 4, pioneer teachers who went to the East and in India and studied mindfulness and brought it back over. And then in like the 80s and 90s, it really started to be picked up in research. And John Kabat-Zinn, who was one of the pioneer, researchers in mindfulness and really implementing this in an institutional setting. And he was given some patients with chronic pain who doctors just did not know how to help them. And he created mindfulness based stress reduction and was able to help these individuals refine their relationship with the experience. And actually, they then had physical improvements. And his definition of mindfulness is an awareness that arises through paying attention on purpose in the present moment, non judgmentally. So that's kind of a formal way for us to conceptualize mindfulness. And I love that definition because it brings in these inherent attitudes that then, as we start to embody, we can feel in our body. And so I think that trying to explain the experience of mindfulness is a really skillful way to not only conceptualize it, but to embody it. And I think that's when we really know we're interacting with it. And of course, scrolling through Instagram and seeing these things and taking in these nuggets all have its place and can be valuable. Yet it's not until we really embody it that we're experiencing and interacting with what mindfulness actually means.
And, for everybody, not just people dealing with a serious medical illness or
Yeah.
bodily pain, it's invaluable. It's just an invaluable life tool.
Mhm. Mhm.
But you're right. People can, I, it's such an awful way to describe it, but it's like you almost can't throw a rock without hitting 1,000 mindfulness experts
It's
today.
true. Yes.
And, Instagram is a place where things can, they have to get distilled down to these like 3-second or shorter, bites, and something can be a little bit lost.
Yes.
But you're talking about even back to the moment when you're in the hospital, your body is not feeling right,
Yeah.
understatement, and you're getting this news that is really life-changing and earth-shattering. And in that moment, you were able to be with that moment rather than
Mhm.
being lost in the emotional reaction to the moment or
Yes.
trying to escape the moment
Yes.
or devalue the moment because it is a different moment than the moment you might want.
Absolutely. Yes. I think, I may have said this, I'm not sure, but I felt really protective over my experience when I was in the hospital because I did have that. What was honest and real for me was this kind of understanding of an opportunity here, and an understanding of, I am going to be okay. And it was like doctors would come into the room and there was almost this like somberness, and I appreciated their reverence. Yet they were kind of assuming my experience. And that's not necessarily, I wasn't fully grieving in that moment. I didn't need that somber approach. And, I felt kind of like how I was meeting this maybe was being assumed differently by others. Um, and so, yeah, I think I did have a very real moment in the hospital, where, and I vividly remember this. I hope I always will. Where I was just laying there and I said to myself, it doesn't matter what happens if I can't see or speak or think. I'm going to have a sense of okayness within me. And it was like a vow that I made to myself, that okayness was going to be there. And again, that's not everyone's experience, and that's okay. And I think you should meet your experience with full authenticity. But that's how I met myself. I told a therapist one time, I'm not a very intuitive person. And they, I have friends who are very intuitive and, almost with like otherworldly intuition. And I was like, I'm just not intuitive like that. And they said back to me, I think you're actually a pretty intuitive person. You have this ability to like see the experience. And I think that's kind of what you're saying too. Rather than having these emotions and these what ifs and, rumination of what could be, I could see the experience almost separate from myself, which is huge, a huge part of mindfulness. And I don't think that I could have explained that to you in a mindful, using mindful verbiage at the time, but that experience was, I was seeing it separate from myself and a part of a bigger picture. And there was a choice there in how I wanted to experience this. And there was a choice of okayness, even if things felt that they were not okay. And I think that we do have that choice. It's not like a toxic positivity or spiritual bypassing by any means.
Definitely,
Yeah.
let's talk about that. And
Okay.
apologies for interrupting, but I want people
No.
listening to know too that your experience is your experience of that moment or in general, and you were honoring it. But embedded in what you're saying too is that
Yeah.
somebody's experience of the moment might be shock and sitting with that,
Yes.
or might be like, I don't want this. And that might be
Yes.
their truth of the moment that they are
Yeah.
sitting with and breathing through in
Yes.
whatever way they can. Your
Yes.
moment to moment experience too is probably not 100% uniform over time.
Yes. Right. We can definitely talk about that.
So, toxic
Yes.
positivity and spiritual bypassing, talk about that a little bit, and also how mindfulness is different from and helps with that.
Yes. It's such an important part of this conversation. And it can get a little complex. But I think it's important to remember, a good way to remember this is, do I feel like I'm resisting any feelings? That was my initial reaction and response. Yet there was definitely fear as a part of it. And there were definitely emotions that were unpleasant in the moment. I think where, this sense of choice comes in is we can know that there's strength and power that can walk alongside the unpleasant and that can be there to kind of pull us up and support the moments that we absolutely can still let live, which may be, fear, grief, discomfort. And that was really big to me, those. Um, I had this, intuitive knowing that things were going to be okay, but that doesn't mean that okay looked a certain way. Um,
Like, fine, and it's no big deal. That's not what you
exactly.
were that's not what you were, like, telling yourself or other people might have told you that, I actually don't know. Did you
Sure.
experience toxic positivity from people?
I don't remember a moment that I experienced toxic positivity then, there, in that circumstance. But I think we all experience that, especially in, the climate of today, that we need to dampen, our uncomfortable feelings, where our uncomfortable feelings can be beautiful teachers and can show us, um, incredible things and even incredible strengths about ourselves going through, the discomfort and the difficult moments. I think for me, I like to see, the discomfort walking side by side with that inherent n- knowing of strength that's there, rather than this inherent strength needs to kind of dampen down or push down the feelings of discomfort. They
Or
can live together. Yes,
or
go ahead.
deny the reality?
Deny the reality. Exactly. Exactly. Um, Yeah, Ram Dass has another quote that I love, not to overquote Ram
Mhm,
Dass,
go ahead.
but um, he was a prolific mindfulness and spiritual teacher. And he had a stroke later in life and lived his last few years of life, in a very different physical and mental state than he did for the majority of his life. And he said, I would never wish a stroke or the disease on anyone, but I would wish you the grace that comes from it. And I think that that's, an interesting way to think of it is, allowing the beauty that can come from it its place, while also recognizing that the experience and the real experience for him with a stroke or for me with MS, those symptoms and, whatever the trajectory may be, I have little control over, but that will manifest in in whatever way it will. I can control, how healthy I can live up to this point, but I still can't control what's going to happen with the disease or whatever else in life, but there can be beautiful things that can come from that. It doesn't mean the discomfort and the pain isn't there, because it is, but there can be beauty that can come out of that also, in addition to that. Yeah. And I think you mentioned, it's not that there was this like steady okayness that I felt in every moment. And there was lots of fear. I still experience lots of fear and anxiety, but I think the knowledge and the beauty of impermanence is so valuable when considering these things, even if it's just the experience of the emotion of fear, or if it's an actual physical experience that's, kind of tipping off the fear that something could happen. All of these things are going to fade away, just like the moments of ease are going to fade away. And there's going to be moments of discomfort that are going to come back in. And that's, a mark of existence, is that there's going to be the easeful moments and there's going to be the difficult moments. And how, we relate to those moments through mindfulness is really how we can learn and grow and, nourish that, that understanding of a deeper sense of what it even means to be here and to be living.
Beautifully said. Melanie, I'm thinking, for people with any kind of chronic illness, MS included,
Mm-hmm.
most often I think people will talk about, and I think you talk about this as well, the lifestyle changes that can
Mm-hmm.
help you feel better generally.
Mm-hmm.
So I'm going to just name a few: movement, eating well, sleep, stress management. How does mindfulness help somebody potentially maybe change the way they approach those things?
Yeah, that's a great question. I think mindfulness can just help us become aware of how, um, sometimes immediately, sometimes longer, time will lapse before we see the effect. But, um, just seeing how these things can dramatically impact our overall, experience physically, mentally, spiritually. One of the beautiful approaches within mindfulness and within meditation is curiosity. If we can, kind of curiously explore without any type of expectation, I wonder how I'm going to feel if I, modify my diet today and, maybe tomorrow. I wonder how that would make me feel, if that would make me feel any differently, without that expectation of I'm definitely going to feel better. I mean, there's a ton of research to support that you will feel better. So there's lots of confidence there that you can move into that, and that is a supportive skill and technique to modify, whether you have chronic illness or not. But yeah, I think just approaching that with a bit of curiosity and then allowing yourself to be mindfully aware of how that does change your experience. Whether it's with food or exercise or meditation. And I think not attaching to the outcome is really key to that. And so going into that knowing, I know these things are supportive and I'm just going to kind of see what happens and how I feel differently. All these things are interconnected. So the way that I eat is going to impact, obviously the way that I exercise, which is going to impact the way that I'm thinking, and maybe I'll meditate differently, and just having kind of more of a overarching, I don't want to say holistic because that has associations sometimes for people, but yeah, it is all tied together.
Yeah, and I'm just thinking, as somebody who previously really worked almost solely with people dealing with medical illness and all the stuff that comes with it, there's such a as you're talking, I was just thinking there's such a range, right? Because you're a person who already had a background in understanding mindfulness and putting it into
Mhm,
practice
mhm,
and, eating well and moving your body. Not that those things maybe haven't also still changed over
mhm.
time,
Yeah.
but, I think one of the things that people often struggle with in the beginning is that I feel so overwhelmed. I feel like I'm still grieving the loss of myself that as I knew myself before.
Mhm,
And, if it's somebody for whom, eating well is really kind of loaded or an
mhm,
opportunity to fail,
mhm,
or moving is something that maybe they weren't big into exercise before and now their bodies don't feel well.
mhm,
And I feel like, sometimes the term mindfulness also feels like something people can fail at if it's newer to them,
mhm,
right? Because they feel so overloaded with all these changes they are being told to make. But I'm thinking just noticing the thoughts and feelings and realizing we don't have to do anything with them, and we
mhm,
can still, like you said, with openness and curiosity, engage in something and say, I wonder
mhm.
what'll happen, even if there's another part of us that is like, I hate this, or I don't want
Yes.
to do this, or this stinks, I just want to go back to bed, or whatever it is, that we can hold multiple things at once
Mhm.
by creating space for them.
Absolutely. I think, the word "and" is one of the most helpful words available to
Love
us.
that you said that.
Yes, I can hate that I'm doing this, and I know that this is, helpful and supportive to my body and my experience. Um, Allowing the experience to be as it is, noting the thoughts that you're having, like, I do not like this. I am noting this is just uncomfortable or, not pleasurable. Noting that. And at the same time, there's the and word, and holding this truth that if I want to change my relationship to this and my thoughts, and again, this is not toxic positivity because we're allowing that uncomfort to be there and acknowledging it and giving it a seat at the table. And we're also pulling up a chair for the part of our brain that we know we have to feed with um, supportive thoughts of knowing that this is positive for your experience, this is good for you, and that this is supporting and an opportunity to shift your experience with this. And it doesn't mean that, you have to have dinner with all of these people on the first night. You can pull up the chair for the displeasure on night one and, then invite over the other one in a couple nights after you've, massaged this muscle a bit more. But research does show that the more we feed our mind with these supportive thoughts, it can actually rewire our thinking and our brain. It's not toxic positivity. We should not, this is going to work in the opposite direction if we start to, if we don't pull up the chair for the real honest thoughts. Again, that's also not an invitation to make thoughts of discomfort. If they're not there, definitely, don't create a problem and, think I need to have these other thoughts. But if they're there and they're real, letting them be there. And then also knowing that we can, feed ourselves with supportive and positive thoughts because we do all have inherent strength and goodness and it's there and there are opportunities. Sometimes these difficult moments are opportunities for us to give those parts of ourselves a place to really step out and shine. Maybe we didn't have the chance to do that before.
And I think embedded in what you're saying too, and this will be familiar to people who already have some sort of mindfulness practice,
Mhm.
but it might be something that people who don't yet have that might not have thought of. But we so often entangle pain whether it's emotional or physical, and usually they go hand in hand anyway,
Mhm.
and suffering.
Mhm.
And like you said, by allowing yourself to have the feelings you have and letting them have a seat at the table instead of trying to deny them, which is the toxic part of toxic positivity, right? Or push them away or drown in them, I think we naturally disentangle the suffering from the pain. And, and just as somebody who formerly worked with a lot of chronic pain patients, like, I think people are often surprised to see how their pain severity just does kind of ease up
Mhm.
without them having to say, I'm going to turn down the volume on my pain today.
Yes.
Um, and the suffering, becomes something we can almost diminish by observing.
Yes. Exactly. It's so beautifully said. Viktor Frankl is one of my favorite teachers. And if you're not familiar with Viktor Frankl, he's, a psychologist and also a survivor of several concentration camps from World War II. And he wrote Man's Search for Meaning. And one of his equations that I carry around with me, I think of it daily. And my husband, brings it into conversation often, is resistance times pain is suffering. And it's that resistance to the pain. If we can just shine a light on it, it's almost, we have this fear of shining a light to the pain. But if we can look at it, boldly, and in its bare form, it's not often as scary as we think it is. And that resistance is really, what creates the suffering. You had so beautifully said that.
And very well said, Melanie. I want to make sure that I ask you, is there anything that I should have asked you that I didn't, that we should be talking about today?
Oh, I have a few really exciting things coming up. The opportunity to work with some educators later this summer, which I'm just thrilled about. I was in education before I went back to do all of my studies. So one of the engagements is 400 educators, and it'll be a mindfulness seminar bringing practices both for the educators themselves and also translating it into the classroom. So I'm really excited about that. And then, yeah, just continually writing and putting things out there. I do have an Instagram, which Instagram and I are learning each other, and it is a practice within itself. My Instagram is Melanie_Lown, Lown. I would love if you'd like to come follow along on that journey with me. You can trust that anything I put on Instagram, I have really thought about a lot. I don't underestimate how many eyes can see that and the different journeys, the myriad of journeys that see what I post. And so I think that's why I don't post often, because I really put a lot of thought into that. So would love for you to come along and join on that journey. And then, of course, you can check out my website, which is melanielown.com. It has my offerings working with businesses and organizations on there. And then mindful mentoring if you're interested in deepening a mindfulness or meditation practice. Yes. So that's kind of what I have going on at the moment.
Oh, wonderful things. Melanie, meditation teacher, advocate, wonderful person all around. So
Oh,
nice to see you. And
thank
thank
you.
you so much for being on the show.
This was wonderful. Thank you so much for this opportunity. Anytime I can, interact with you and take all of your wonderful goodness and inspiration insights is such an honor. So thank you.
Likewise. This has been another episode of Unpacking Possibility. If you enjoyed the show, please remember to like, share, and follow. And of course, as always, until next time, be well.